Hey everyone, today we're going to be going over a critical appraisal of limited diagnostic accuracy of MRI and clinical tests for detecting partial thickness tears of the rotator cuff by Brockmeyer, and it was published in 2017. The objective of the study was to determine the diagnostic accuracy of MR and clinical tests for detecting partial thickness tears of the rotator cuff, as well as a combination of these parameters. For the PICO, the P was diagnostic accuracy of MR and clinical tests for detecting partial thickness tears of the rotator cuff. I is diagnosing partial thickness tears of the rotator cuff based off MR and clinical tests versus the gold standard of shoulder arthroscopy. C is comparing the diagnostic accuracy of MR and clinical tests to the gold standard of shoulder arthroscopy. And O is detecting partial thickness tears of the rotator cuff. The study design is a diagnostic study and its level of evidence is a level 2. The patients included, there was 270 included in the final study, mean age of 54 years. It ranged from 19 to 81. They all had an MR clinical test, being the Job test and the impingement sign test, and the gold standard of an arthroscopic finding or a shoulder arthroscopy, meaning they underwent surgery for that shoulder. Inclusion criteria, they had to have a rotator cuff pathology between January 2010 and December 2012. They had to have an MR clinical test used with the Job test and the impingement test, and the gold standard also being an arthroscopic finding. So they had to undergo a shoulder arthroscopy to be included in this study. The exclusion criteria was arthroscopic revision surgeries and arthroscopic joint lavages in cases of septic shoulder arthritis. 334 patients who underwent shoulder arthroscopy for rotator cuff pathologies between January 2010 and December 2012 were looked at. Clinical testing they underwent was the Job test and impingement signs, pre-op MR. Reports were evaluated with regard to the integrity of the rotator cuff, so they were determined as intact, partially, or completely torn. And the study compared this against the gold standard of an arthroscopic finding. All reports used the Ellman classification to determine the kind of rotator cuff tear. As we know, they only used 270 of these individuals. And looking at the diagnostic values for determining the rotator cuff integrity, we can see that the sensitivity and the overall specificity aren't the highest, but the specificity for using all three, so MRI, Job test, and the impingement test, was 85.4%. But the positive likelihood ratio was not high at all. So that means that if we had a positive MR, positive Job, positive impingement, there's not really a good positive likelihood ratio that our rotator cuff pathology would be indicated. As well as looking at, there are also poor likelihood ratios for just MR, just Job test, just impingement tests, as well as negative likelihood ratios. So ruling out with a negative test isn't great. The results of the study, so there was limited accuracy of MR and clinical exams, so the Job test and the impingement sign, for diagnosing partial thickness lesions of the rotator cuff. There was a low sensitivity, specificity, and a really low positive likelihood ratio for all. All three tests together had the best specificity at 85.4%, but the likelihood ratio was low at 3.21. This does not improve the diagnostic accuracy except for specificity. Looking at the quadus of the study, it rated 10 out of 14. The interpretable intermediate test reported, other than the exclusion criteria, no withdrawals and no uninterpretable or intermediate tests were reported or explained. And then it didn't really discuss the time period between the reference standard and the index test, other than they had to be there between 2010 and 2012. So depending on when the individual was seen, when the tests were done, it didn't really specify and it wasn't very clear. And then it also didn't discuss whether or not the reference standard results were interpreted without knowledge of the index test. Take-home points for this is that MR and clinical exam have the highest specificity when used all together, 85.4%, but there's a low positive likelihood ratio of around 3. It's not great at ruling in partial thickness rotator cuff tears if these findings were positive. We want to utilize them to get better outcomes. We have to realize that this is not reliable for diagnosing or ruling out partial thickness rotator cuff tears. We would want to use shoulder arthroscopy to be fully sure that there is a shoulder rotator cuff tear.